few seconds before 10 o'clock according. Oh, here we are. Good morning, everyone. Today is Thursday, May 14th, 2020. It is the 10 o'clock hour. The Board of Supervisors of the County of Del Norte and the governing body of all other special assessment and taxing districts for which said board so acts is now meeting special session. Right now, we're going to take a moment of reflection. Okay, and Bob, if you'll now please lead us in the Pledge of Allegiance.
Thank you, Mr. Chairman. All right, everybody. Ready? Pledge. I pledge allegiance
To the flag
to
the United States of America,
To the republic
for which it stands,
under God,
one nation,
indivisible, with liberty and justice for all.
justice for all.
Okay, now I am going to open it up for public comment. This will be for public comment on things that are not on the agenda. Is there any public comment?
Chair, can you hear me?
I can.
We do have one raising their hand at the moment. Do you want me to read the written public first, or do you want us to go out?
Is the written public comment have anything to do with what's on the agenda?
Yes.
Okay, no, let's wait, please.
Okay. Robert, are you here? Can you hear us?
Hi, guys.
Hi, Robert.
Hi. I really just wanted to address, since we're meeting this morning, kind of the element of meeting this morning, about 48 hours instead of 72 hours, you really think a big emergency would be happening right now. Maybe the streets are flooding or something, but, conflicts of interest, I think should be a topic that we address. I know, like Henry David Thoreau said, like, a corporation, truly has no conscience, but a corporation of conscientious men and women truly do have a conscience, and I think a lot of the time, we confuse honesty with lying. Just because you don't lie doesn't mean you're not being honest. And I'd like to, I'm just, honestly, I would have missed the meeting, but it just kicked in my head yesterday that Jay said this would be a special meeting. And I said, I better look to see if there's a meeting, I don't think that this meeting was an emergency at all. I think the emergency factors, you're supposed to be doing something to preserve our health. I think this meeting is caked in special interest. I think everybody involved, putting this meeting on should disclose their interest. I think Chris owns like 2 or 3 vacation rentals, or at least he manages them on VBRO. And I was able to book it this morning, for a couple days. It looks like it's pretty well booked all summer. Looks like just that one's worth $40,000 in, summer, I know that, and I'm not good at hiding my financial interests. I've never been a good business person, but if you're good at it, I guess you can open up a corporation or whatever and not look like you really have it or something like that. But I'd like to know, Ms. Cowan, are you involved with that Scopa by the Sea? I know Rogers said he didn't, he doesn't rent his house, but his wife admitted they rented it, in the previous season, summer and fall. And when I looked on, there was 500 a night, and I think if there's 4 vacation rentals there, I think we're getting to the point where there's, might be about around $250,000 of interest just between 2 supervisors. And, you guys, I noticed Hemmingson recuses himself a lot, and I just never noticed anybody else doing it. And, we really got to make a government people can trust. I always figure if we show up to the government, we can trust the government because it's a government for the people, by the people. I think county council once told me, we'll have the government we deserve. And I believe that. And so really we need more people showing up. We can't really blame you guys. We need more people so that, they can supervise the supervision. Thank you for your time.
Thank you, Robert. Is there any other public comment, Kylie?
I'm going to give it just a couple seconds. I'm not seeing any. Oh, wait, excuse me, there is one. for Ramona Machado.
Okay, go ahead.
Mona, can you hear us?
I can hear you.
Okay,
All right, you're good to go.
Okay. I was very concerned when I read a story in the North Coast Journal where Dr. Renwalt was suggesting importing coronavirus to our county. I want to say that I am strongly not in favor of that. I am also a vacation rental owner in Del Norte County, and I understand why vacation rental owners would definitely want to open their rentals and receive income for the season. However, if it's at the expense of the health of the people of our county, that is unacceptable. That's my statement.
thank you very much. Is there any other public comment, Kylie? Nothing?
Sorry about that. I thought I was unmuted. I'm not seeing any, Jerry.
Okay, all right. So we're done with public comment. We're going to move on to item number 4, which is to approve and adopt a conveyance for Del Norte County as requested by the Del Norte County Public Health Officer, Dr. Raywalt.
Mr. Chairman, point of order. May I be recognized, please?
Yeah, Roger, go ahead.
We all have this attestation document in front of us. When I looked at mine, the boxes were blank. In the statement in letter to Dr. Angel to Sacramento, asking for a waiver and variance to stage 2 of California's roadmap to modify the stay-at-home order. In speaking with the healthcare district this morning, they were unaware of the answers in the boxes provided by Dr. Raywalt. And they have great concern about our action today and moving forward. The public is unaware. Now I'm going to ask all of our board members, because I happen to have a copy of the filled in boxes on the variance to stage 2 of California's roadmap to modify the stay-at-home order. I'm not able to scroll through all the answers because it is a printed copy, but if it were on a disc, then I could scroll down and actually look at the answers. And I am suspecting each of my colleagues on this board does not have the answers to this blank check letter that we're going to be sending to Dr. Angel if we approve this. I'm asking that this matter be delayed and put on the next upcoming agenda, perhaps on Monday or Tuesday, on a noticed item, so that all members of the public, including our Board of Supervisors, of which I have the boxes filled in, and you may or may not, I know information that you don't know. And I'm asking that this matter be tabled until Tuesday, until the public and all members of those who are listening out there now have access to the actual attestation document. I'm asking for it to be tabled until Monday or Tuesday in special meeting.
Jay, we've discussed this, and since Roger doesn't seem to want to talk to staff about how to get the information, could you explain it, please?
Well, there's a couple of things that are happening in regards to the information. The information that is in the form, the attestation form, is in the attached documents that are also in the agenda item. There, and Dan can also assist on this one from the IT end. That attestation is a live document that the state of California has and can be edited. So when putting it on there, there's a scrolling feature, but some of them are, I believe the earlier version did not allow that, but the information that goes in those individual boxes, and again, I can also refer to Dr. Raywalt on this, is in the supporting documents that are attached to this, the narrative that's there also. So yes, there's a couple of documents that were the originals that have limitations regarding the scrolling. And all I can really say at that point is that the information that goes in those boxes is in the documents that support this.
And I've actually read the narrative. I see some of the answers. It's kind of disjointed, but I also have a document which has the answers in the boxes. Now, explain what you will, the public does not have access to this information. And I'm disturbed at the fact that we're moving forward. I asked Supervisor Berkowitz if he had it. He did not have this document in the boxes. Now, we may have it disjointedly as it may appear in the narrative, which I have read a number of times. I see some answers to it, but it doesn't refer to the individual questions. And I think it's an easy thing to do is to put the document I have in front of me to all of us so that we can see the actual box answers. I know the healthcare district, in speaking with them this morning, did not have the answers to these questions, and they've expressed a concern, and some of us should have a letter in our box expressing that concern about some of the actions taken by Dr. Raywald, which appear to be acting in some kind of a vacuum. There's a lack of clarity, so opaqueness over whether we have a full disclosure. We have the healthcare district, which is out of the loop. We do not have stakeholder involvement. And there's obviously a conflict of interest where Dr. Raywald sits on the board of the Sutter Coast Hospital. When I asked that question yesterday about expanding Sutter Coast's involvement in testing, he said it could be a burden on them. Well, he also sits on the board and he's bound by confidentiality agreements. So I have to bring this to our attention. We need to have clarity. We need to have understanding. It's not Supervisor Hemmingson saying Roger doesn't understand this. Mr. Hemmingson, that public doesn't understand this. And we are, if we move forward today on this item 4 without full disclosure of the public involvement, we are signing a blank check to an attestation agreement, which we don't know the answers other than in a disjointed manner, which is confusing to the public. So I can't move forward on this at this time. I am very interested in moving forward and getting this variance passed, but doing so in full disclosure. And I also want to discuss how we move forward into phase 3 in a safe and responsible manner where there is full disclosure.
Chair, may I say something?
Sure.
Okay, so I'm clearly the one that puts the agenda together and sends it to all you guys. The attachment with the boxes, it was a live document. When I uploaded it to the website, which was yesterday morning around 9:30, it was a live document. And when I scrolled through the boxes, the public would have actually been able to edit the document. So I contacted our IT department and they had to change the file settings, so they weren't able to edit the live document. And something must have happened between here and there, so where they weren't able to see the whole boxes. And it came to my attention a couple hours later, late afternoon yesterday, and I had IT fix it. And I'm actually looking at my screen now. I'm on the public page and I'm able to scroll through the boxes and see all the answers. I'm not sure what happened or what's going on, but it's all there. I just wanted to say that.
Yeah, okay, thank you. Is there anybody else that has a concern with this or that has not read through the information that we've gotten on this document, that we need to table this and push back going into phase 3 farther? Because my understanding is that until we get through phase 2, the 2 weeks from the time that we start getting through our phase 2 is the earliest that we will be able to get into phase 3. Is there anybody else that has an issue with this document and wants to table this for another special meeting? Okay, so I have consensus that we're going to move on, and we'll start with Dr. Raywald. Maybe you could explain to us. I know that there's been a lot of public comment on what you've said about introducing COVID-19 into the area, and maybe you could explain a little bit about that.
Certainly, I'd be happy to. So let's go back a couple of days. I think if you recall during my presentation during the board meeting, I talked about my growing concern at the time that it had been so long since we'd had proven cases in our county, despite a mounting number of tests, that I was becoming very concerned that we had effectively stamped out COVID-19 in our county on a temporary basis. And that going forward into reopening added a different level of peril to us in that we can't predict with any certainty when we might have gotten a new case into our county. And if we had moved into stage 3 or beyond before that happened, and the first case introduced a whole series of cases, it could create a surge within the community itself that was unplanned for, simply because we had nothing going on in the earlier stages to measure the effect of relaxing the restrictions. That's the heart of my concern and the heart of the argument that I presented to the state to allow us to introduce a couple of measures from stage 3 to increase the chances that we actually would have active disease in our community as we're going through this process. And it's important for everybody to understand, if you don't have any cases going on and you start relaxing things, you have nothing to measure the effect. And that creates a potential problem down the road. That was my only concern. That was my only reason for doing this. Fortunately, since then, the very same day we made the presentation, late in the afternoon, we learned word of a new case in our county. So my concern has been eased considerably. We've started investigation on this case. We're pretty far along in it. We don't know if there's a connection to the other cases that happened essentially 3 to 5 weeks before. We don't think so at this point. We're still checking into it. But the fact that we have another case here is important, because it tells us that by hook or crook or by chance, whether it was connected to the other ones or not, or it's just a new case that arrived in our county in some fashion, there's going to be some disease activity, at least for the foreseeable future, which is good, because that's what we wanted to have. We wanted to make sure there's a little bit of activity going on in the community before we start relaxing things. And because if we relax too much and there's nothing going on, we have nothing to measure the effect of relaxing these stay-at-home measures that have been in place. So essentially, when that happened, I took the initiative and decided we needed to rewrite our proposal and exclude the request for any stage 3 component. And at the same time, I reached out to the state because they were pretty dubious about doing this. And I think the reason is they didn't want to open the door on other counties considering this. You know, they need to kind of have a united front against requests like that. They told me quite frankly that there was really zero chance of it going through that way anyway. So rather than present the argument, which was about, the heart of the argument was about 5 paragraphs of text that would have been in the attestation document that you have, we struck it out. We rewrote to reflect the fact that we have a new case that is just brand new to us, but still our only case in the last 14 days. We're going to present it as just a standard phase 2 variance request like the other counties are doing. And we'd like to act on it as quickly as possible. And the reason we want to do that is because if by chance we get another case before we take action, then we would not meet that first requirement of epidemiology. And I would like to point out to all the supervisors, the reason we presented the answers in the attestation document that we're supposed to submit to the state was to allow you to review the categories of requirement that we needed to meet and understand the questions that were driving our answers and the narratives that we created. So you have both the questions and the answers as we present them. And I thought that was important. We decided that it just needed to be included in the package that you received and the public can review as well. But if we don't move on this quickly, we may lose our window of opportunity, because if we get another case on top of the one that presented this week, we cannot qualify under that very first category of epidemiology, which states emphatically, and they have not varied from this, the state has not allowed any flexibility on this, that you can only have one case in the last 14 days. So now we are kind of in a time window here. And I would appreciate that the Board of Supervisors consider that as they make their decision, decide to support this. As far as the healthcare district, I would have loved to have participated in their meeting, but I did not feel it was appropriate for me to answer their questions on this very topic before discussing this with you. Because as a county employee, I answer to you as the Board of Supervisors, not to the healthcare district. So I was happy to discuss it with him in greater detail and answer any and all questions about this and present my reasoning and my logic behind my initial concern, which, as I stated, is now essentially gone to way on the back burner. I'm really happy that we have another case because it eases my mind a great deal. And I'm hopeful that we actually get a few more cases. I just don't want to have them happen in the next 14 days because, especially if we don't follow through on this attestation as quickly as we can, because we might lose our window of opportunity to move into this stage 2 variance, which will allow some of our businesses to reopen and allow a little bit more flexibility for us in the next 2 to 4 weeks. So that's a summary of what has transpired. As I said, we've taken the phase 3 request completely out of this. We are doing a standard phase 2 variance as many other counties have done. And we are asking for a letter of support from you. The requirements from CDPH, from the California Department of Public Health, were that we have a letter of support from our Board of Supervisors and a letter of support from our healthcare facility, Sutter Coast. We have a letter from Sutter Coast. We're asking that you provide an additional letter supporting this request to the state so that we can proceed.
Okay, thank you, Dr. Rowalt. I appreciate that information. Kylie, is there any public comment? Anybody got their hand raised?
Yes, I'm seeing 2 so far, and the first one up would be Jessica. Jessica, can you hear us? Maybe we'll try Robert. Robert, are you on?
She's up. Jessica, she was muted.
Or Jessica, are you there?
Not hearing anybody.
I'm not-
Jessica should be able to talk right now, so give her just one more minute here.
Okay.
Okay, I'll move over to Robert and then we'll see if Jessica can fix her audio issues.
Hi, guys, can you hear me?
Yep.
Hi. So I would like to start, it's a serious inquiry. A lot of the people in the community have it. And we'd like, a statement from all 5 of you as far as your holdings regarding this, because it was surprising. We were all kind of expecting barbershops and maybe restaurants. And that was my idea when I came at you early in March, was saying, hey, let's make a community where we feel safe in the future so we can all serve each other. It's going to involve not seeing tourists this year, but they're not going to come anyways, the idea of importing this virus, whatever your doctor's telling you, is a unique joke in this country, that a little tiny unprepared community. So we do everything to prepare right up until get sick, right up until that point of getting sick. We're doing preparedness so that we're ready in case, because a sickness is a bad thing. We don't need to gauge it if we need to see how it works out. New York has showed us, as I told you, if 1 out of 500 of us die, and that would represent like a 0.5% mortality with 40% of us getting it, 1 out of 500, how many is that? That's like 4 dozen, and you all have to look in their faces. So every one of you need to tell us what your holdings are, including Jay. Everybody tell us if you own a vacation rental, because it was weird that you skipped barbershops and Airbnbs were important. They were going to use it as a lure to bring the virus to our community. And, so Chris, I really think that Chris and Roger, because they haven't mentioned anything, should recuse themselves from anything further regarding reopening in our community. In fact, I think they should step down. How can I book a Airbnb from Chris's house this morning? This is ridiculous. And I think it's criminal, and it needs to be dealt with as such. And I'd also like to nominate, I'm sure that he's got a lot on his plate and he won't take it and the governor needs to appoint him, but I'd like to nominate Dr. Caldwell as our new public health officer. It's so rare that we get a nomination. People kind of run out of special interest and narcissism and stuff like that, or get appointed out of favoritism. As I've noticed that the Caldwell clan doing so much for the community, and I know it would be a burden on him, and I'm sure he's got too much on his plate. But I nominate Kevin Caldwell for a public health officer, and I would like Dr. Rowalt to step down. We've all spent too much money and too much time trying to do the right thing to see this nuttiness. I wouldn't be surprised if you see this on Last Week Tonight, with John Oliver, to see a public health officer over and over again. want to bring a virus to a community that just last week had no resources, who just last week you guys said, hey, we don't want any prison transfers because we can't have this in our community. This is a big conflict, and it's going to dissolve trust in our community. And so we need to deal with it immediately. The vacation rentals need to come down, or at least they need to only be able to be booked for a month at a time to legally comply. And Chris Howard, you do need to recuse yourself. Roger Gitlin, you do need to recuse yourself. And the letter that was sent has no bearing on what the doctor said yesterday in the video. And one, we were saying, hey, we're ready. It's almost like you guys took an economics homework project and you tried to submit it to your science class with some whiteout. And it's disturbing, it's dissolving the public trust. Thank you.
Thank you, Robert. Appreciate it. Kylie, is there any other public comment? Did we get Jessica on the line yet?
I'm not seeing Jessica's hand raised anymore, but I do have one from an Aaron Scroback.
Okay, Aaron, are you on?
Okay, can you hear me?
Yeah.
Yes.
Go ahead.
All right. All I'd like to say is that I think that we should move slowly going forward. There's plenty of other small communities that we can gauge how this disease is going to progress in other parts of the world and other parts of our state. We don't need to be first in line to open anything up. So I'd just like to say that we should move cautiously going forward. And that's all I'd like to say. So let's proceed cautiously. Thank you.
Thank you. Kylie, any other comments?
Yes, Ramona Machado.
Hi,
Hello.
can you hear me?
Yes.
Yes?
Go ahead.
Hi there. I'd like to agree that the owners of vacation rentals should recuse themselves from decisions that are made about vacation rentals. That's it.
Okay, thank you, Ramona. Any other public comment, Kylie?
Yes, Jessica Sejnar.
Okay,
It isn't Jessica. Can you guys hear me?
yeah.
Okay, good. Yeah, I'm using Jessica's link because we're all sitting here over at KFUG and listening. I have a question about how the Dr.
Who's
Ray.
this?
I'm sorry, Paul Kritz.
Okay, Paul, thanks.
So I have a question about how the variance that is being asked for, how that has changed now with what Dr. Raywalt said about the new case changing his thinking drastically. Is he no longer asking for that specific slide into phase 3 with the opening of the rentals? Is that off the table now? Are we back now more with the other counties, Northern California counties that have gotten a variance and are opening up?
Yes, that's absolutely correct.
Okay. So I'd like to know what then is functionally speaking, what are we talking about now as far as stage 2 variance and businesses that will, how will the scene change now as of today with this variance that you're asking for?
Well, nothing changes today. It has to be submitted and then it has to be approved at the state level. And they will post our attestation, make it a publicly available document at CDPH. After they've approved it, that's when local restaurant owners can start planning to open up restaurant operations according to the CDPH guidance document that was just published, I believe, yesterday. There's some standards that are expected to be met, but they can start proceeding with that. There will be a rollout with retail businesses. There's what they call destination retail, which I think they're implying is a mall. And I don't really know how to categorize our businesses in terms of a mall venue. I don't think there's really much distinction, but it basically opens up those two areas for the most part, according to my understanding of the stage 2. So there are a few other things in stage 2, particularly some easing of restrictions for dental procedures, which is useful to have. But nothing else from beyond that. So those are the major changes.
Okay. And that's just a standard stage 2 then opening And that's available for the public to see in this document on the California Public Health website.
Yes, I mean, there's a reopening plan outline that shows all the various components of the different stages that's available through the governor's office and through CDPH. It's pretty easy to find. And by doing this, we are requesting just a standard stage 2 variance like all the other counties. We have tabled the idea of trying to import anything from stage 3 and bring that into the stage 2 variance request because there's no basis for it now. You know, my concern about not having disease here is pretty much gone. We have another case. So I decided we don't need to do that. We don't need to try and prove that case to the state, and we proceed alongside the other counties doing the same process. So this is a standard stage 2 variance request.
All right. Thank you. Thanks for answering my question. And I'll talk with you at noon, Doc.
Yes, I plan to be there.
Thanks. Yeah, and Dr. Raywalt, this is a public comment period. So if you would hold that, maybe take some notes and wait until public comment is over, and then you could address all these things. If we start getting into a dialogue with everybody that gets on the phone, we're going to run into issues. So
I apologize.
No, that's fine. And it was a great question, and I think it might alleviate a lot of the other public comment. So that's fine for this one instance. But let's hold everything until we get all the public comment in, and then we can go back and address those things and take care of that. I appreciate it. That. I just wanted to mention that to you. Kylie, is there any other public comment?
I do have one, and it's just under initials ET.
That's Eric Taylor. Can you hear me?
Yeah, go ahead, Eric.
I just want to make just quick comment. My understanding, I know we talk about California because we're in California, Northern California counties, but my understanding that Curry County is opening back up, that Brookings, their hotels, restaurants are open. I believe it's a little naive for us to think that those folks that are coming to those areas aren't going to be coming down into our area as well. So I'm not in favor of this continued lockdown. It doesn't make a lot of sense. I'm definitely not in favor of having any of our supervisors recuse themselves. I think we need representation from everybody right now. So I just want to make the comment that we just continue moving forward. I mean, I'd like to see it move faster, but in any fashion we can continue moving forward, I say we need to do that. We need to get the economy up and running again. Other localities are opening up. I don't see how we continue to stay locked down. And that's my comment.
Okay, thanks, Eric. Appreciate it. Anything else, Kylie?
Seeing any online, let me just double check. There's quite a few people on, so I'm just going to scroll through and see if anybody else has their hand raised.
Okay.
I am not seeing any, but I do have a 2-page letter from the healthcare district.
Okay. You're on mute.
I don't know if you caught it, but I do have a 2-page letter from the healthcare district that they wanted me to read.
Okay. Can you get done with that in 3 minutes?
I'm going to try. Okay. This letter is being forwarded to you on the authorization of a motion by the Board of Directors of the Del Norte Healthcare District. As the staff report before you indicates, many healthcare agencies were provided the attestation narrative, which is perfectly attached to the staff report. Our agency was apparently overlooked as a recipient of that narrative. The district was also not included in any discussions regarding the plans to reopen the county. We don't know the completeness of the information that you have before you and whether the variance attestation contains the complete responses to the state's questions positioned. We only have available what is available to the public in general, which has a text that fits within the box but does not contain the complete responses to the questions. We have unsuccessfully attempted to gain Dr. Raywald's participation in our last meeting so we could be enlightened with the basis of the logic being employed in support of the variance. Furthermore, the district is, we believe, understandably concerned and cautious about the Del Norte County Public Health Officer's proposal to expedite opening the county to short-term travelers for the purpose of importing coronavirus into our community. Accordingly, this district is of the opinion that the Brown Act's purpose of providing complete information to the public is violated when we are unable to provide the board with informed public comment based on an incomplete document. This process has been moving very quickly before the board, And given the virtual manner in which we are now conducting the public's business, we do question whether the public is really informed of the nature and extent of the requests being made by the public health officer. In fact, it would concretely appear that if the public is limited to the access that the district has, it could not be so informed. Our request is that the board make the entire variance available to both this district and to the public so that we can all carefully consider and inform public comment. The health of this community is our public charge. This, of course, equally applicable to the public health officer and the Board of Supervisors itself. Thus, we believe that we are all on the same side here, and we respectfully request that you delay consideration of this letter of support until the facts are known and the decision is fully transparent. It may well be that once we are informed of the facts contained in the variance and the logic of the health officer, that the healthcare district will be fully in accord with the recommendation. Unfortunately, we are not now and could not be, given the present circumstances, in position to reach that conclusion. It goes without restating that Del Norte County is federally designated health professional shortage area. It has a very small isolated hospital with inadequate staffing to handle expansion of capacity if a number of patients present with the infection, It serves both Del Norte and Curry counties. The nearest hospital in California is approximately 90 miles away and does not fit the criteria of testing within 60 miles at the present time. Del Norte County has a large population of seniors who are at higher risk of developing severe COVID-19 disease. Del Norte County is an isolated region with limited emergency patient transport capacity for COVID-19 patients, and there's no air ambulance transportation for COVID positive patients to other hospitals. Residents of Del Norte County, excepting essential business and professionals, have been ordered to shelter in place in order to slow the curve of infection so that healthcare facilities are not overwhelmed by COVID-19 patient pursuant to the governor's executive order N-33-20. We are one of the counties that has been successful in the sacrifices that have been made to keep the number of infected down to a low number. Additionally, literally billions of dollars are being spent on attempting to scientifically identify both the symptoms and effects of this disease and its treatment. We are still in an early stage of that process, but it appears rapid progress is being made. We recognize that a considerable amount of this community's economy is tourism related and that there is a natural impact to restart our economic engine. However, without the information that the district and the public at large would gain from the complete text of the variance attestation, it initially appears to be it's hard for me to read this letter, it's very faded, non sequitur to want to open up the population to intentionally induce disease into the population. Respectfully submitted, and it's signed by Kevin Caldwell, Chair of the Del Norte Healthcare District.
Okay, thank you. Is there anything else? Any other public comment?
Robert's raising his hand again, but he's already spoke, so.
Yeah. Okay.
I am not, let me just scroll through real quick. Like I said, there's quite a few people online. I am not seeing any other people with their hands raised, so no, not at this time.
Okay, great. Okay, so at this time, I would entertain a motion.
Mr. Chairman, may we have additional board discussion on this before we entertain the motion?
Sure. What do you want to say?
Well, Dr. Raywald, are you still online?
Yeah, he's still there.
Okay.
I was on mute. Sorry.
All right. Thank you, Dr. Raywald. Dr. Raywald, words matter. Words matter when we're discussing a situation like this. When I'm hearing you say, I'm happy to see another case come in here, I have to take issue with this. I'm not happy to see any new cases come in here. And in the three previous cases, I will refer to you case number 3, which the public does not know the circumstances. I asked you about how this case 3 became prominent, and because within 48 hours, that announced case was already on the road to recovery, non-hospitalized. And you gave me a HIPAA type answer. You're not able to discuss this, but what I've come to learn on this is this individual made a stop at the Sutter Coast Hospital for a test, and for reasons unknown to me, was declined the test. He went up to Gold Beach, got a
Supervisor
test.
Given, would you
Well,
stay
this is
on?
important.
We're talking
Excuse me,
about
Mr.
the-
Chairman, this is important, and I would appreciate your not
It's
interrupting
only
me.
important to
I'm
the
making
item that we're
points that are-
discussing.
You know what? You can argue with me all you want. This needs to be made public, and you're obstructing it, sir. When you
I am
interrupt
not
me,
obstructing
you-
anything. Stay on
please
point,
be a
please.
chairman and let me finish my narrative. I won't be long, I promise you. I know you probably want to go to lunch and it's past your 3 months, but I am going to say what I need to say. This needs to be made public, and you're in the way right now, so please be quiet. Now, I want to finish this conversation by saying to you, Dr. Raywald, this individual went up to Gold Beach, was tested, and by reasons that are not clear to me, the test came down to Del Norte County as a Del Norte County test, was the third case and was promptly dismissed. Now, I have issues with transparency, that there are things operating within a vacuum, that we have stakeholders who are not informed, the healthcare district only being one of them. How many individual restaurants and or motels have you spoken to ask them how they consider it safe to open up into stage 3? This is only a stage 2 document waiver. I understand that. I have some issues with your conflict of interest that you sit on the Sutter Coast Board and were resistant to me asking you to expand that as some kind of a burden on the Sutter Coast Hospital. I'm not interested in hearing that. I want to hear that Sutter Coast Hospital is an equal partner and will do everything and anything it can to expand the base of testing rather than sending people down to Arcata, which is unreasonable and frankly won't happen, or expanding into closer Curry County where we can take testing up there so we can increase from the 95 that we're currently doing to 150 or perhaps 200. So these are questions that I hope you not sit in conflict. I don't want to know that you're bound by confidentiality agreements, that you cannot divulge what goes on inside a Sutter meeting, but I am of the opinion, and the public would want to know, that we can expand our local base of testing at Sutter Coast, and they will do so willingly and expeditiously. Now, these are concerns that I have. And as far as this waiver of 2, and Mr. Kritz and the rest of you are down there, if you don't know what's on that document, we are signing a blank check. I'm very much in favor of this variance of stage 2 California roadmap to stay at home, so we can move into an honest and healthy and robust discussion on how to safely and responsibly open up into stage 3, which most of you are calling about now. They're not at a stage 3 discussion right now, Mr. DeRigo and the rest of you folks. We are at a stage 2 to move on to stage 3. So I'm concerned that the public is not fully aware of what is in those boxes and has to some kind of mental gymnastics go to the narrative to figure out what the answers are in those boxes. And it was just admitted by Kylie that it wasn't correct until late last night. So there's a lot of opaqueness here that the public is not aware of. And I still think we should delay this vote until Monday or Tuesday when the public is fully aware. And you folks who are sitting around listening to this should be saying that makes good sense rather than just willy-nilly moving into stage 2, and then we can have into stage 3. I fully support the stage 2 variance. I think the public is unaware of what's inside those documents and they ought to be aware. Now you can take the microphone, Mr. Hemmingson.
Thank you for
Chair.
keeping it so short.
Chair,
You're welcome.
can you hear me?
Yep.
I just want to say that it was not fixed late last night. I was only here till 5. It was fixed in the afternoon yesterday, probably around 2:30. I do
Yeah.
admit there was a couple hours after I posted it that they weren't able to read it because, like I said, it was a live document that the public was going to be able to edit. So we tried to fix that. I just wanted to make that clear. I did not get it updated late last night.
Okay,
Okay.
apologies to you, Kylie, on that. I don't think the public has seen this document. And that's the point I'm trying to make to my colleagues on this board.
Is there anybody else that has any questions or public comment? I mean, public comment. Any comment? Board members?
I just think Mr. DeRigo better figure out who he booked with because he didn't book with me this morning. So not entirely sure who he booked with, but hopefully they'll give you a cancellation there, Mr. DeRigo.
So,
I would like to save my comments until we have a motion and a second on this, and then I'll talk about it.
okay. Do we have a motion?
Supervisor and Chair, I just want to doubly make sure this is just that what was published on our agenda. That is a phase 2 only, and that what Kylie published, which was the additional items at the bottom of the agenda, which were the filled boxes that were not editable, is what we're voting on today. Is that correct?
Yep.
Which is a phase 2 variance. And thank you, Dr. Raywall, for spelling that out very clearly. I would make that motion.
Thank you. I have a motion. Can I get a second?
I'll second.
Okay, I have a motion and a second. Now, board members, would you like any further discussion? Mr. Berkowitz?
Thank you. Dr. Raywald, I was concerned about your statement that if we had one more case in a 14-day period, that we could delay this. So if we had one more case, how long would we have to delay it?
I don't know. I don't know if the option would be available. Nobody, none of the discussions that I've been involved with the state officials who are running this has really addressed that issue. It's just that going into it, when you make the request, you have to have that epidemiological fact of having had only one case in the last 14 days in your jurisdiction. I presume the best answer I could give you today is that we would have to wait for 14 days after the last case, whatever it is, before we could resubmit an attestation.
So if we had a case, let's say next week, and we'd already approved this, then 7 days later, we had another case, we could basically delay this forever. Is that correct?
Well, if it gets approved by the state, as far as I know, at that point, the epidemiological requirement is not looked at. But I have no way of knowing if they're going to change their rules and come back to look at counties and say, you have not maintained your epidemiological requirement of one case in 14 days, therefore we're going to revoke this. That could happen. I don't want to tell people or mislead people in any way, shape or form about how this could play out. All I know is that going into it, as you make your application the first time, that is the strictest requirement, that you have had only one case in 14 days. So if we have a case, if we submit it and it gets approved and we have another case next week, that case may be irrelevant to this purpose, depending on what happens after that. If we get 10 cases next week, all of a sudden, I would have to report that to the state, and they might actually come back and say, we're going to waive your variance because you clearly have a cluster of cases and you need to deal with that first. And they would be right to do so. That would be absolutely true. I would not want to proceed into a phase 2 variance with a cluster of cases showing up all of a sudden. But as it stands, I think it's safe to proceed today. And I think it's safe to ask for your approval and submit the attestation and see what happens.
Thank you.
Anything else?
Just a quick question for the doctor. Thank you for all that you're doing. First off, I know everybody's been working hard and reaching out. I know you've been reaching out to businesses and trying to get everybody's input, which is appreciated. Once this is submitted, what do you think that turnaround time is going to be? Do you think you're going to have an approval within a day or 2 days? Do you have any idea about that?
My understanding of the process is that it gets submitted, they review it, and then take it to Dr. Angel, the state health officer. And after she's reviewed it and approved it, it gets posted online. And other counties have asked for a notification of some sort that it has been done. Originally, they were just going to post it online and have us all look to check and see if it was there. And that was going to be sort of the approval process. But I think we would probably receive some communication from them that it's been accepted. And that would be when we would be able to move into phase 2 variance. That could happen in 48 hours. I don't foresee it happening today if we send everything in today, but it could be by close of business tomorrow or certainly on Saturday is a possibility.
Great, thanks. One more question. I noticed Humboldt started doing type of a registration online for their businesses to get in compliance with you. How are you going to proceed going forward? Are we small enough that it's just going to be one-on-one in person, or is it going to be done online? Do you have any idea how you're going to do that?
We've considered doing it online. Most of these questions are being handled by the economic resiliency team because they've really stepped up and through this with the businesses. And I think they've got a better handle on how people would like to proceed. There's no requirement to do it online or by documents. we worked on some working documents for people to start reporting their business plans even before the state guidelines came out. But right now, I mean, pretty much with state guidance in place, people have to kind of follow that as their rule. And yeah, we've opened up the option of having them submit it to us. We'll review it and say you're good to go.
Right.
We don't know if we have the capacity to go and check every place before they open business. We'd like to be able to do walkthroughs down the road, and either myself or our environmental health specialist or both of us, and just kind of check everything off and see that they're meeting the terms of their plans. But that's weeks away probably before we have the capacity to do that or have everyone's plans in and ready to go.
Right, and that was my concern. So I was hoping that there would be a more expedited way, and using the Economic Resilient Task Force to help do that, since it's already set up and they are communicating with our businesses. Obviously, once we start, it's most important, and once we get approval for our community and our economic to start opening up. So hopefully you'll use them, and we can expedite this with a follow-up from you after they're open.
Absolutely.
Thanks.
Okay, thanks, everyone. Thank you, Dr. Raywald. I appreciate you staying ahead of this and staying on point. Great job for all you and your staff doing excellent work. So very happy with what you've come up with. So at this point, Kylie, would you poll the vote, please?
Supervisor Berkowitz,
Yes.
Supervisor Gitlin,
In view of the public not being fully aware of this document in attestation form, I vote no.
Supervisor Cowan,
Yes.
Supervisor Howard,
Yes.
Chair Hemmingson.
Yes. Okay, that will conclude all of our items on the agenda. At this time, I'm going to ask for public comment, though, on our closed session. We're going to have a closed session this afternoon. And so I'm going to ask for public comment on closed session items only. Kylie, is there anything?
I'm seeing Robert Dorigo has his hand raised, but it's been raised for some time. So I'm not sure if it's related to closed session or not.
Okay, Robert, do you have something on our closed session items?
Yeah, this is the closed session to deal with county council.
Yes, it does.
Have you guys been operating without county council lately?
No, we have been operating with Elizabeth Cable, who is there on the screen.
Joel's no longer there though, huh?
What? No,
Joel.
everyone is still here. County council is moving on to another job, our current one, and we are interviewing for new county council to replace her.
I'm sorry, Councilor Cable, is somebody who takes
have a
revenue?
comment, Robert?
Yeah, I have a question
You have a
about.
comment. This is public comment. You have a comment.
Well, I just was curious, like Chris had said that I can't rent his house, and it's true, I didn't rent it. I set it up for 3 days. It said book now. I'm like, it's like a couple grand. And I'm like, do I want to spend a couple grand to make a point?
Robert, we're talking
But I mean,
about
like if that
we're
happened
talking
right now,
about
like Walker
closed
Road, was that like ethical for like the opening of, I mean, I agree with opening of Walker Road, but was it ethical for Chris not to mention he had an Airbnb across from it that he was renting out?
closed session items, Robert. We're talking about the closed session items that we are.
Well, I think it involves the closed session items because it deals with, bringing county council in. So, I think it involves with because it's going to affect your guys' ethics, whoever you hire, and I know sometimes like the law and ethics, they go like sometimes under and over each other. And so what I would do is I would take the level of ethics up so high that it's always above the level of law. So sometimes you're going a little bit, above the level of law, even, to really comply with ethics when you hire your next counselor. I would look for somebody who's really like a boss, like somebody who's gonna hold you to an ethical standard and not just a legal standard. Because I do notice, county council has to, that's a big part of the job on the board is county council talking to you guys and making sure that you're, staying within the means of laws and ethics. And I think a big part of that is to implore a large community trust, because you really need trust in your government. So we see our government doesn't work so well, but we see other governments work really well. And what I've noticed the common thread is the people that in those governments that work real well have people that are involved in their government that have a high level of trust. So I think the next, if you're going to hire another county counselor, the next one needs to be one that not only thinks, and I'm sure that current ones, are very ethical. I was like Joel's comment, is stuck with me for, I think, 2 years now. And he told me once that people will have the government they deserve. And so I want us to just deserve the best government that we possibly can have, and I've kind of accepted that. Every time I see anything in government, I say, well, that's what we deserve. A lot of time I'm the only one who, well, I'm not the only one. There's a few people who show up, but it seems like such a small portion of the community get involved. And so I think like a county counselor with an ethical regard that is above the law would be imperative in case, renting your Airbnb that's directly affected by actions that you take, to deal with policy for the county, is not illegal. Maybe it's not illegal. But so we can understand sometimes things that are right and wrong, sometimes maybe they aren't legally corralled. I thank you for your time, and I appreciate everything that you guys do through a time when I don't want to be out there breathing in people's faces. Thank you.
Thank you, Robert. Any other public comment on closed session items only?
Chair, I am not seeing any at this time.
Okay, well, thank you very much, everyone. We will reconvene in closed session at 1 p.m. today. Thank you very much.